You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. So after the surgical removal of the right submandibular gland, the patient could no longer depress the right angle of mouth as well as the right lower lip, and also this patient could not raise or elevate, or was having difficulty in elevating the chin part, and also this patient was having difficulty of course pouting the mouth as in this. So what happened during this surgical removal of the right submandibular gland, and especially in talking about this, I'm talking about during the skin incision. So the next question that we will ask you is that what precautionary measure wasn't really adhered to during the skin incision, of course in the submandibular gland area, to reach the submandibular gland. Now the next thing is that what other important nerve could have been injured during the skin incision, into, of course, the submandibular gland area, and what will be the clinical manifestation of such injury. So this is today's case study. Now the first thing I want you to understand is that the nerve that is involved or that has been injured in this regard during the skin incision in, of course, the submandibular gland area is, my friends, something that we call the marginal mandibular branch of the facial nerve. Marginal mandibular branch of the facial nerve. Remember, whenever you hear mandibular nerve, you're talking about the trigeminal nerve, but that's not the case. This time, it's a branch of the facial nerve. Now, one thing that I want you to understand is that this marginal mandibular branch of the facial nerve runs in the fibers of what we call one of the panniculus canossus muscles we have in the human body, the platysma muscle. So it runs in the fiber, the upper fibers of what we call the platysma muscle, around about 1.5 centimeters below the body of what we call the body of the mandible. So that's one thing I want you to understand. And so the precautionary measure that should have been taken is that usually the skin incision should be made about 2 centimeters below the mandibular base, the body of the base of the mandible. That's one thing I want you to understand. So that, of course, in such a case, then you don't cause injury to, of course, this marginal mandibular branch of the facial nerve. The reason why we're seeing this clinical presentation of the patient is that the right marginal mandibular branch of the facial nerve, in this case, the right side, will be relevant in supplying, depressor anguli oris. And that is why if the nerve that is supposed to supply the right depressor anguli oris, is injured, then there will be paralysis to, of course, the depressor anguli oris. And that's why the patient could not or was having difficulty in depressing the right angle of mouth. And not only that, this marginal mandibular branch of the facial nerve also goes on to supply what we call depressor, labii inferioris, depressor labii inferioris, and that one will be relevant in supply to the right side, the right, lower lip. Yes, the patient will not be able to, depress it. And my friends, this same right, marginal mandibular branch of the facial nerve will be relevant in supplying the right mentalis muscle, and this right mentalis muscle, will be relevant in helping, of course, synergistically with that of the left to, of course, raise what we call the chin part over here. And it's also relevant in, of course, pouting, of what we call the lip, of what we call the mouth. And that is why the patient was having this kind of difficulty in doing that. Now, the other thing I want you to understand is that one more nerve, could have been injured. And which nerve is that? This time around, running in the fibers of what we call the platysma muscle, and therefore supplying it, this time around, is the cervical branch of the facial nerve. Cervical branch of the facial nerve. Because the cervical branch of the facial nerve will be relevant in supplying this platysma muscle that we're talking about. And so that nerve is also very susceptible to getting injured Yes, of course, in the skin incision into what we call the submandibular gland area. And so what we are going to see is that this patient will be having some kind of difficulty this time around in, of course, depressing, the neck. That's one thing that we're going to see. And an important thing which I want you to understand, already I've mentioned that the platysmal muscle, yes, a flat muscle, is one muscle which we find is in the superficial fascia of the neck. It is one muscle which is, of course, a panniculus canosus muscle. Yes, whenever we talk about panniculus canosus muscle, then it means that it's that muscle which will have subcutaneous attachment. And therefore, upon contraction, will cause wrinkling of the skin that overlies it. And that is why this platysmal muscle, when its nerve supply by way of the cervical branch of the facial nerve is injured, it will lead to paralysis of this portion, the right side of this platysmal muscle. And therefore, this patient will have difficulty in causing wrinkling, okay, in the neck, region. So that is one thing which I want you to understand as far as, when you are going to perform or any kind of skin incision, okay, into the parotid gland area, into the submandibular gland area, okay, then you have to be very careful, be mindful that the skin incision should usually be made about 2 centimeters, yes, around 2 centimeters below the body of, the mandible. My friends, I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.